Hi everyone, Dr. Tagari here, and we're talking about a very, very cool topic, perioral Botox. Now when we teach our aesthetic training course with Avalon Aesthetic Training Academy, one thing I always talk about with beginners is always stay above the nose until you gain proficiency. But if you're seeing an experienced practitioner, such as Avalon Laser here in San Diego, you are going to get some really cool applications of Botox that are going to help rejuvenate the lower face. Now, let's talk about the lips. Okay, that's pretty good. Let's talk about, that's a nose. Let's pretend it's a nose, right? One thing I'm going to recommend for folks who come to me for lip augmentation is application of Botox. This is number one, the lip flip. The lip flip is a really cool technique where application of Botox in the lip can actually elevate the upper lip and reduce the protrusion that occurs when you place lip fillers. Sometimes I do lip fillers in two stages, and I do the lip filler first with a small amount with a lip flip to increase the volume of the upper lip, and that protrusion effect is diminished. The patient comes back and they get a second dose of their filler, and then you can fill a more natural looking lip. Pretty cool, all right? The second thing that we could do is treat the gummy smile. Now, the gummy smile is a different placement, and this is kind of cool because a lot of folks, when they smile, the upper lip pulls up so much that they see the gums. It's not really a desirable thing for a lot of people. So a lot of times folks will say, well, what can I do? With proper placement of Botox or Dysport, we can actually fix the gummy smile, and this just has to be done in experienced hands, okay? The third thing is going to be smoker's lines. Now, smoker's lines don't have to be because you smoke. Most people don't smoke nowadays. But smoker's lines are these lines that occur in the upper lip. Not very attractive. A lot of times it's going to occur just because you drink through a straw or just because it happens genetically. But because those lines are edged, a lot of times before somebody comes and I'll put filler in there, I may actually say, let's stop the problem at the source by putting some Botox or Dysport in this area and making sure that we eliminate the muscles from doing this. By treating the problem at the source, a lot of times we can even avoid having to put fillers, which saves you money, which is great. But treating the problem at the source is the first thing I do before I start putting fillers in there. A lot of times I can combine the Botox or Dysport with the filler, and it's a synergistic effect, okay? And finally, we've got a little bit of a fancy word, angular depressors. And I know if you got these, you don't look happy. Maybe that's why they're called the depressors, because it makes you look depressed. This is where you have the depression in the corners of the mouth pulling down, and it's because the muscles doing this are overactive. So by treating these muscles and relaxing them, the edge of the lip can come up, and you don't have that resting angry face that you don't want to be having, okay? So these are just 4 applications of Botox or Dysport, okay, around the mouth that can rejuvenate this really, really crucial area. In experienced hands, and when somebody who really has some proficiency in how much to put, where to put, and how cautiously to put, you can treat these 4 very common conditions safely and effectively and get results that last for months. And sometimes the results, if you're doing it on a persistent basis, can actually be almost permanent. Pretty cool. In any case, I hope you enjoyed watching this video. I appreciate you guys coming to our website. Look forward to seeing you for the next video.